Hey, I'm Amy. I'm going to be your nurse today, and I'm going to be talking to you about something that could happen after delivery called postpartum hemorrhage. There is this governing body called the American College of Gynecology, and they set the standard for how OBGYN is practiced in this country. They say that postpartum hemorrhage is when you have lost a total of 1 liter of blood since you had your baby 24 hours ago, or within the first 24 hours. This can happen with moms who are in labor for a long time, have had lots of babies, delivered really quickly, not giving the uterus time to appropriately stretch and contract. So making it what we call uterine atony, or just kind of like floppy and not really clamping down the way we want it to after you have a baby. Really big babies, like if you have a really big baby, then the uterus is stretched a lot and it kind of gets kind of tired and floppy again. Any kind of injury to the uterus or cervix, which can be, there's lots of different things that can happen. You can have a laceration to your cervix during delivery, or you can have something called a uterine rupture. Sometimes that happens with people that have had previous C-sections and there's a weakened spot in the muscle, and that can just sort of rupture, and that can cause a lot of bleeding, which can be a serious thing. The placenta growing over the uterus opening, which is called the cervix. So if you think of the uterus like a balloon, and here is the opening, this is the cervix, and the placenta sort of grows over the opening, so then when it opens up, it has bleeding because all those blood vessels are just exposed to the outside. Or if the placenta tears away from the wall of the uterus, and that's called a placental abruption. It can also happen if a piece of the placenta breaks off after delivery and is stuck inside the uterus, and your body sort of is trying to keep pushing it out, so you're having a lot of bleeding. This looks like a lot of heavy bleeding, like I said, in the first 24 hours after delivery. It's, you're saturating a pad in 15 minutes or less. And again, adding up to about 1 liter or more of blood within the first 24 hours. This can obviously cause some pretty serious problems and symptoms like anemia or even shock, which is basically where you've lost so much blood that your heart is having trouble pumping, and it's not able to effectively pump because there's not enough to pump through there. Okay. We're going to be checking on you while you're here in the hospital. The nurse is going to come in and take a look at your pad, take a look at if you have any cuts after you had the baby in your perineal area, the area between your vagina and your anus. If you have any areas that had to be sewn up, we'll be coming and looking at that to make sure there's not a lot of bleeding coming from there. They're going to look at your pad, and they're going to weigh your pad, so that they just can keep a closer eye and make sure that you're not losing too much blood. And you will also have an IV for that reason. In case you were to have a lot of bleeding, we can give you medications through the IV, or if you needed a blood transfusion, you could get that through the IV, and we would need to have that established pretty quickly because it can be an emergency. There's also medicines we can give. We can give medicines through the IV. We can give medicines in your muscle, like an injection in your muscle. or there are some medicines that they can give rectally in your bottom that can help clamp down the uterus. Let's see. And we also can give something called Pitocin that can, help your uterus become a little more tone again, like your muscles are tone. Your uterus is a muscle, and it helps sort of reestablish that tone where it sort of clamps down like we want it to. Okay. If you notice heavy bleeding, like soaking through a big pad in 15 minutes or less, call us immediately. Or if you are dizzy or lightheaded or feel faint, call us immediately. There's a call bell in your room. Just push that and tell them what's going on, and someone will come in and help you. Now I have a little pop quiz to see if you can remember what we talked about. You ready? What would make you call for the nurse immediately in the first 24 hours after delivering your baby? That's right. Good. Great. Okay. And then second question and last question is a multiple choice. So we might give you medication to stop the bleeding, A, through an IV, B, through an injection, or C, rectally. And then the final one is D, all of the above. That's right, D. Great. Do you have any questions for me? Okay, great. It was nice talking to you and nice meeting you.